Hello everyone, I'm Norazebah Hamidon from University Technology Malaysia. Today I would like to present the paper with title Validity and Repeatability of Inertial Measurement Unit for Measuring Walking Gait Parameter of Patients with Lower Back Pain. Walking is complex dynamic task that require an individual to generate and resist the variability of multiple direction force around the joint. Septal-temporal gait parameter known as temporal, time-dependent, and septal, distance-dependent refer to gait characteristics such as velocity, cadence, step time, double and single support direction. Gait abnormality are commonly observed in patients with severe musculoskeletal disorder such as lower back pain. Lower back pain patients tend to walk slower and reduce cadence during walking. Understanding gait analysis for lower back patients can provide information for effective examination and treatment. Conventional measurements such as sigmoid walking test cannot provide gait parameters such as velocity, stride length, and stride time. Gold standard measurement methods such as Bicon system, which are able to analyze gait parameter effectively, but it costly, time-consuming, and special area needed. Several low-cost instruments such as Kinex and webcam are available in clinical study, but it limited to a small capture volume and only a few step counts of walking are available for data collection. Initial measurement unit, known as IMU, was examined in many clinical studies to overcome this limitation, but it focused more on healthy subjects and some pathology conditions such as osteoarthritis, Parkinson's disease, vestibular disorder, and stroke patient. IMU was used for analyze the lumbar kinematic pattern for lower back patient and certain gait parameters such as gait velocity. Because of that, we intend to determine the validity and reliability of the septal-temporal gait parameter using the IMU on lower back pain patient. This study was recruit 20 convenient subjects with age 35 to 65 years old, diagnosed with chronic non-specific lower back pain from physiotherapy department, Hospital Sultanah Aminah, Johor Bahru. Patient can walk independently, having current and recurrent episode of lower back pain without unilateral leg pain, no numbness or no nerve involvement, reading scoring 1 to 7. We use two instruments. IMU itself consists of sensor placed on both lateral shaft and dorsum of feet, while Bicon axis used as the gold standard measurement consists 6 fixed infrared camera and 60 reflector marker placed based on plug-in gait model. We analyze 6 septal-temporal gait parameters, include cadence, stride time, step time, stride length, and step length velocity. This protocol of study was approved by Medical Review and Ethics Committee, Ministry of Health. This procedure was done in two setting areas. The first is physiotherapy department. The first patient was screening for inclusion and exclusion. Physiotherapy assessment was done and appointment was given to patient for data collection at Motion Analysis Lab, School of Biomedical Engineering and Health Science, UTM. Protocol of study was start with calibration of machine, 5 minutes warming up, walking for familiarization. After that, the first trial will start with walk at the self-selected preferred speed along a 6.5 meter walkway, and patient will has to rest for 50 to 20 minutes to prevent fatigue before start the second trial. For the offline data processing, for the Vicon, we use Polygon 4.3.3 software. iMU, from the signal processing sensor, convert to algorithm using EMG work analysis software and calculated by set segmentation. For the statistical analysis, we use two statistical analysis. For determine validity, we use Pearson R correlation. We value p-value below than 0.05, while reliability, we use retest reliability between the first and second trial. We found that out of 30 out of 20 subjects were analyzed, for men and 9 women. The 7th subject was discarded due to technical issue. The table 1 found that high significant correlation with p-value 0.05 between iMU and Vicon system. Cadence and stride time was influenced the reading of the step time, stride length, step length and velocity. The second is test-retest reliability between the first and second trial for the two different placement of sensor. We found that moderate to excellent agreement using iMU sensor for sharp placement and poor to excellent agreement for the foot placement sensor. We can conclude that iMU sensors are reliable in terms of measuring gait parameter for lower back patient. For your information, this is the first study to determine the validity and reliability of sector temporal gait parameter using iMU for lower back pain patient. We use stride segmentation identified by Lee et al. 2010 are valid and reliable tool. However, some procedure must be considered to ensure that measurements are more precise and vulnerable. The first is 10-meter walk demonstrate the excellent agreement to allow the complete acceleration and deceleration. The second is 2 or more complete trials can guarantee the result is more reproducibility. It approved by this study showed that most septotemporal gait parameters are valid in second trial. iMU demonstrate the better validity on foot placement compared to sharp placement of sensor. It was supported by previous study found that gait event detection improved if sensor placed closer to the ground. In conclusion, iMU sensor reliably and accurately measure cadence, stride time, step time, stride length, step length, and velocity in lower back pain patient. Placement of iMU sensor at the foot are suitable for lower back pain patient, and the patient feel more comfortable during the walking test. Reliable solution to assess sector temporal gait parameter in the clinical setting for this study. This study also represent the first step in developing a new understanding of prognosis and rehabilitation management for lower back patient in Malaysia. This is my references. Okay, thank you.